But here now I am giving the morphology of uh, flavivirus, okay, which is as this is the structure of flavivirus. It's spherical and 40 to 50 nanometer in diameter. They contain the single stranded positive sense RNA, okay, single stranded positive sense RNA, and inner viral core is surrounded by a lipid envelope, okay. Inner viral core which is surrounded by a lipid envelope which is covered with glycoprotein peptidomers and matrix of membrane protein. And now we are looking up in the characteristics, okay. Characteristics of dengue is it's often characterized by fever of sudden onset, headache, retrovalvular pain. Retrovalvular pain is including the which means the eye pain when your eye become pinkish red in color, and some irritation pain occurs. This is the common characteristics of dengue or the symptoms, okay. Next is the conjunctival infection and back and joint pain, lymphadenopathy sometimes more often it's seen that one leg or one arm is swelling. Okay, lymphadenopathy means the swelling of one hand or arm. Sometimes the swelling of both legs and both arms are included in the lymphadenopathy, okay. Next is maculopapular rash, which means the patchy red color rashes, which is often similar to the red color rashes just like in the measles patients, okay. And this dengue is and it is endemic and often epidemic in the tropical and subtropical areas of particularly in Asia and the Caribbean, the Pacific, and some areas of West Africa. In India, dengue is common in the east coast, okay. It has four serotypes. Dengue 1, that is Den 1, Den 2, Den 3, and Den 4. This disease is transmitted by the Aedes aegypti mosquito. And now here we are looking upon the clinical features of the dengue fever. And this disease may occur in two forms. One is classical dengue, another one is dengue in more serious form, that is the hemorrhagic manifestations, okay. And first of all we have to look upon the classical dengue fever features. Okay, next the classical dengue fever. This is usually affects the older children and adults. It has a relatively begin course with fever, headache, and pain in muscle and bones. The fever is typically biphasic. That means the saddleback. A incubation period is 5 to 8 days. When the onset of the fever, it takes 5 to 8 days for dengue. And a maculopapular rash generally appears on the third and fourth day of the fever. The febrile illness lasts for about 10 days, after which recovery is generally complete. It is rarely fatal. Okay, and next you have to look upon the hemorrhagic manifestation, which is very fatal, and it the it includes the other dengue may also occur in more serious forms, that is hemorrhagic manifestations. These are also known as DHF and DSS. DHF means the dengue hemorrhagic fever, and DSS means dengue shock syndrome, okay. It appears to be most confined among children of 5 to 10 years age group, in where multiple dengue viruses can cause diseases. it appears to be hyperimmune response. That means when the DHF or DSS occurs, it gives the hyperimmune response. It is seen in patients previously infected with the dengue virus. Those patients previously which are infected also in the dengue virus, such that kind of patients are suffered from if they again suffer from the dengue, they have the most then they have suffered from this hemorrhagic manifestations. That's why here said that it is seen in the patient which are previously infected with the dengue virus. Okay, on the reinfection with a different serotype of virus, the antibody uh, formed against the first virus reacts with the second serotype virus and forming the immune complex. The initial symptoms are like those of the dengue fever but associated with hemorrhagic rash and thrombocytopenia and shock. Okay, the mortality rate is 5 to 10%. This disease is more often found in epidemic form in the Thailand, okay, and Southeast Asia, and sometimes in India's east coast. Okay. Now here we are looking for the lab diagnosis, and for lab diagnosis some specimens are collected first. What are the specimens? First, for the antibody detection, serum results taken, and for antigen detection also the serum specimen also taken, and isolation of virus and PCR, serum, plasma, and whole blood, autopsy tissue. These are also taken as specimen sample. Next is the hematological diagnosis. This hematological diagnosis, it includes the thrombocytopenia. This thrombocytopenia is the disorder related to the blood and bone marrow. In this hematological diagnosis, we basically count the platelets number. In thrombocytopenia, what happens here the platelets number is lower than the normal count, as the normal count for platelet is 1 lakh cells, 1.5 to 4.5 lakh cells per microliter blood, but in case of dengue it is less than 20,000 per microliter. So that when you use this technique, thrombocytopenia, by using the hematological diagnosis, you could identify the number of platelets found in blood. Okay, and the next is the uh, hemoconcentration. Hemoconcentration means is the decrease in plasma volume, and when the plasma volume is decreased, we could calculate the hemoconcentration with the we should check the concentration, which is 20%, um, 20% rise in hematocrit. Okay.